Absolutely. Come on up, John. Okay, we'll call the Senate Standing Committee on State and Local Government. This is meeting one of the special session to order. Madam Clerk, if you could call the roll, please.
Senator Alvarado.
Here.
Senator Harper Angel. Here. Senator McDaniel. Here. Senator McGarvey. Senator Schroeder. Present. Senator Southworth.
Here.
Senator Storm.
Here.
Senator Thayer.
Here.
Senator Wheeler.
President.
Senator Nemes.
Present.
Senator Mills.
I'm here. Appears we have a very good quorum here for our meeting. The first item on our agenda, we have two bills we're going to consider this afternoon. First item on our agenda is Senate Joint Resolution 1. And President Givens is in the room, and he will be presenting this resolution. Senator Givens.
Mr. Chairman, thank you for the invitation to come before this committee and propose for your consideration Senate Joint Resolution 1. I'm confident all of you have it in your packet. I'd like to move through it rather quickly, but I need to create for you a small bit of context. With the passage of Senate Bill 1, Senate Bill 2, House Bill 1 last session, and then the affirmation by the Kentucky Supreme Court that the General Assembly is the legislative policy-making body of the Commonwealth, we're here for you today we're here in front of you today to selectively extend some administrative regulations, executive orders, and directives issued by the governor with which we feel are necessary. So the resolution, as you have it in front of you, starts with a reminder in that fourth paragraph that everything we're doing in here lives only until January the 15th of 2022, by which point in time we will be back in session. Section 1 specifically extends 28 executive orders in whole or in part as designated by each one of those 1 through 28 bullets, again for the period of January 15, 2022. In addition, it explicitly explains that anything not specifically extended by the resolution are of no further force or effect. If you flip through those 28 pieces, 28 executive orders, you'll arrive at Section 4. Section 4 specifically extends 29 administrative actions in whole or in part. And the majority of these are going to be for purposes of permitting remote authorizations, remote signatures, attending remote meetings, some licensure requirements that in these times we don't need people having to deal with. Not that they're not important, but that the need to address them in light of COVID is more important. Section 5, after you get through those 29 administrative actions, you arrive at Section 5. And Section 5 is something, and I've got to pause here for just a moment and acknowledge the hard work that our staff and the House staff has done working through all of these executive orders, cabinet and agency orders, guidances, memoranda, directives, or bullet actions that have been identified in this document. One of the biggest challenges was finding a place where these could be accessed. Not intoning that this was the intent of the executive branch to do these things in darkness, not intoning that at all, but simply acknowledging the fact that we have no singular posting location. Section 5 clearly delineates that all of these actions herein shall be forwarded to the Secretary of State for posting prominently on the Secretary's website until the conclusion of the COVID emergency. Government, well-intended, has been promulgating lots and lots and lots of rules, regulations, bulletins, memoranda that are very hard to find. This is going to consolidate them in a much more easily accessible place. Section 6 prohibits similar emergency orders in whole or in part on substantially similar facts and circumstances. Section 7 acknowledges the need to continue the state of emergency in the city of Carlisle and Nicholas County. Section 9, nothing in this resolution shall be interpreted to allow state agencies to remain closed for regular in-person business. Section 8, that I skipped momentarily, sorry about that, indicates that as the law now requires, if statutes are suspended, they have to be reviewed by the Attorney General for approval of that suspension. Section 10, it's not the intent of the General Assembly that this joint resolution delay or impair any access to federal stimulus or pandemic-related funds, and then the typical disclosure regarding the need for this to be in effect as law upon signature by the governor or other passage there in Section 11. Certainly would entertain any questions, Mr. Chairman, that committee members may have.
Any questions for Senator Givens? Senator Alvarado has a couple of questions.
Thank you, Mr. Chairman. I'd like to, Senator, to page 7 of the bill, line 16, number 19, the Board of Nursing Emergency Memoranda dated March 5th, 2021.
Senator, my version may be numbered a little differently. Do you know the section number?
Section 4, subsection 19.
All right.
This has to do with this is the Board of Nursing. I've got the Board of Nursing action pulled up here, and I know that your comment was that having these things in light of the COVID-19 is more important to have these things done. And I've expressed this to you privately, but I'm going to bring it up publicly, that this section also gets rid of the CAPA CS requirements of oversight. Right now in the law, I think new nurse practitioners, I believe, have a 1-year requirement before they can write controlled substances. They also have a requirement to have a collaborative agreement with physicians for oversight of narcotic prescribing. I'm not really sure how writing controlled substances helps us combat COVID-19 or helps us in a state of emergency. Maybe you haven't heard the news, but I think we've had a 49% increase in overdose deaths during COVID-19. We've pulled the data over the past 10 years. I think we've seen physicians reduce their narcotic prescribing by 40%, dentists by 50%. Nurse practitioners in that 10-year span are up 500% in narcotic prescribing. Benzodiazepines, which are Schedule 3 through 5 drugs, they're up 800% in prescribing. This was suspended, really, by their board. I'm not sure that they have the authority to do that. But at this point in time, in light of the recent surge of overdoses of people and fatal overdoses that we've had, to suspend something purely for the purpose of having a group of practitioners who are exhibiting an increase in their prescribing habits for that, to say you're going to be able to prescribe more, I don't know how that helps combat COVID-19. I'm hoping maybe you can help us with that.
Senator, first, I think it's very appropriate that we acknowledge the difficulties many folks have struggled with during this time of COVID. That is tragic. 49% increase in overdose deaths is tragic. It's reflective of the challenges people have because we are a communal creature. We as humans are communal creatures, and it saddens me to know of those numbers. Senator, you have certainly raised that point to me in conversation, and likewise, as I have researched some and talked with folks in the nursing industry, the nursing folks bring different numbers. Now, are we at a point in time when access is critical? Absolutely. I think you and I both agree that access to care is critical right now. I think we've got quality nurses, we've got quality doctors. Far and away, by far, the vast majority of our professionals are that. I don't know if we specifically, based on your information, that you're indicating that we have nurses who purposely are over-administering and over-prescribing for the purpose. I don't think you're intoning that they're doing it for the purpose of creating overdose deaths. But I sense that you indicate that they're not capable or not skilled enough. Share with me your thoughts.
I'm just asking, Senator, how this helps us combat COVID-19 by removing the CAPA CS.
Access to care.
Access to more, CAPA CS is to do with prescription of controlled substances. So how does that access to that help us combat COVID-19?
So the recurring theme that you've seen in this regulation and in others is a removal of requirements that are administrative in nature. And so, Senator, my response is going to be this correlates with many of the other waiving of some of the continuing ed requirements, waiving of some of those paperwork requirements that are well-intended but are bureaucratic in nature.
Okay, Mr. Chairman, thank you. So I disagree with that. In CAPA CS, we're talking about, and again, I think your comments were, is to have these in place. I think your words were, in light of COVID-19 is more important. waiving the Kappa CS has nothing to do. Nurse practitioners are independent prescribers. They can prescribe the medications and treatments for COVID-19 with having this in place or not having it in place. So to waive it is specifically to allow a group of practitioners who are increasing by 300 in number, and I'll be happy to, I think you've had the data that I've shared because I've collected it from Casper every year. And since we're including this now and saying we want to sign off on this factor, that's the concern that I've got. We've got market increases by certain groups of prescribers who are prescribing more of this. I've talked to the Board of Nursing about it for oversight, and it's been an issue. We have physicians overseeing this purposefully for that factor, but during this past year when this has been suspended, and again, I've got the Casper report numbers. I'd be happy to share them with you. We've seen our physicians and dentists write less, and our nurse practitioners have written more. So if the question is about access to care, I would encourage also, we've got about 200,000, I think, national openings for nurses right now in our hospitals. We have 325,000 nurse practitioners. If they're wanting to help us with access, the access we need right now is in our hospitals. That's where the access is required. We could, nurse practitioners, RRNs also, and I'm hoping, and I've channeled this to some of our hospitals as well and partners, to ask our nurse practitioners to go back to their roots, be able to do some of this hospital work that's required right now where we have a tremendous need. But waiving Kappa CS, which is specifically a physician to collaborative agreement for physicians for the oversight of scheduled drugs, which are all controlled prescription drugs, to make sure that is being done, to have that, we have that in place for a reason in our law. To suspend that does not increase our access for treatment of COVID-19. It does not help in the treatment of COVID-19 in any way. It merely allows practitioners to have that oversight removed to be able to write more controlled substances. Thank you, Mr. Chairman.
Thank you, Senator. Senator Thayer has a question.
Well, thank you, Mr. Chairman. And I'm on Dr. Alvarado's side on the Kappa CS. I've long opposed the expansion of it, much to the disappointment of my sister, who's a nurse and lobbies me on this all the time. But the decision was made to include this in the bill just temporarily. Just goes till, I think it's January 15th, Senator Givens?
That's correct.
To help get more frontline APRNs to help battle the situation we have in our hospitals. So I wanted to help clarify that. Thank you, Mr. Chairman.
Senator Southworth has a question.
Thank you, Mr. Chairman. I'm going to focus on Section 2, where we are discussing the 2020 executive order from March 2015, or 215, I'm sorry, the executive order 215. And it says in the paragraph number 1, we're going to have it in effect 2020 executive order 215, which declared a state of emergency to the extent necessary to, and then there's listed 3 things there. To the extent necessary, and then some of these things also, we might as well just say what they are. Senate Bill 5, Senate Bill 150 from 2 sessions ago. I'm trying to get a handle on the extent necessary, and how do we limit when we hand a state of emergency to a governor who under 39A can do anything he wants that we've put in there, which we've put in a number of things, Senate Bill 1 and other items. How do we limit to the extent necessary? Sounds extremely vague and sounds almost like the same problem we're trying to solve here, which is get everything in one place and actually list out what, referencing all of these things all over the place.
So, Senator, great question. If I may respond, Mr. Chairman.
Yes.
Great question. If it ended, if that, this is a drafting construct, and it's a very clear, explicit drafting construct. If that ended with extent necessary, you would be exactly right. It would be very ambiguous, very undefined. But the drafting construct that works very well in law and in bill drafting is when we limit it with A, B, and C. Extent necessary to, the word to and the colon and then the 3 bullets, limit the extent necessary to those 3 constraints.
Mr. Chairman, can I follow up?
Yes, you may.
Extending the state of emergency in January is just pretty much a repeat of last year when I was hearing. I wasn't a member of the legislature, but it burnt me up then, it burns me up again. Wait till we get back, we'll fix it later. And I think it's time to quit kicking the can down the road. This is our time to act now. the state of sickness in our state is not going to change for the better by January. It's just not. And the state of sickness is not the same as a state of emergency. There is great sickness. There's more sickness now, I think, than any other time in my lifetime. And it's getting to be very scary and dangerous for a lot of people. I don't think anybody's even talking about that enough. But this is certainly not a state of legal emergency. And this is the thing that we need to come to a realization. Other countries have already gotten there. We need to figure out how to live normal lives and not always say this is a special circumstance. It's not. I mean, it is, but it can't be. We have to move on. One final example that goes along with what Senator Alvarado was mentioning on paragraph 24 in section 4, the Board of Chiropractic Examiners orders relating to SARS-CoV-2 mitigation and continuing education. Any other board in here, you almost will not see SARS-CoV-2 mitigation. Why in the world does the poor Board of Chiropractic get hammered out on SARS-CoV-2 mitigation, but then the other boards? I mean, if you look at these orders, it's just some of this stuff's got nothing to do with where we really need to be going. I would really love to solve some of these problems, but I don't think that extending a state of emergency and giving blanket ability to do more stuff without careful consideration is the answer. Thank you.
Senator Givens?
Mr. Chairman, if I could respond briefly.
Yes.
Senator Southworth raises a question I think is something that we all need to acknowledge. We are in difficult times, and I pray for all of our frontline healthcare workers, as I know all of us do. I pray for all those families that have lost loved ones and individuals that are struggling with COVID. I pray for all of those and hope we all do, because we all want well for our fellow man. The legal sense of the word emergency and the cultural sense of the word emergency, and I think you delineated those not purposely, but rightly you did. And so when we talk about a declared state of emergency from a legal sense, it has a different context than a cultural sense. I sadly am moving to the place you are with regard to what we're calling a cultural emergency in our communities and in our families and across our lands. We've been in such a long state of emergency that it's normal now. Sadly enough, these challenges are becoming more normal. For legal purposes, when we say declaring a state of emergency, that provides the ability to do A, B, and C, limited to that. So I think there is a difference between a cultural sense and a legal sense.
Okay, our final question is from Senator McGarvey.
Thank you, Mr. Chairman. Senator Givens, as we've heard some of these numbers here today, I want to talk a little bit about the state of emergency that we are in. Total cases as of September 3rd, 592,489. Total deaths, 7,845. Current hospitalized, 2,365. Current in the ICU, 661. Currently on a ventilator, 425 of our fellow Kentuckians. It's a statewide positivity rate of 13.17%. And the stories are heartbreaking from every corner of the Commonwealth. From Norton Children's Hospital, which is at capacity with kids, because we know this Delta variant attacks kids in ways the initial virus might not have. As I said on the floor earlier, I got a text from a pediatric nurse at Norton who said they are turning away non-emergent cardiac surgeries for kids because they do not have the room in the hospital. But it is not an urban problem anymore. It is a Kentucky problem. There are tents, emergency tents, set up outside the Pikeville Medical Center. The tents are up at St. Clair Regional Center in Moorhead as well. The National Guard has been dispatched to Bowling Green, Moorhead, Pikeville, Hazard, because of the volume of patients from COVID-19. I bring that up because of the way we've structured state government in this state. Forget who is governor right now. Let's talk about the office of the governor and the legislative branch. The Constitution currently says that the legislature can only meet between January and March in odd-numbered years and January and April in even-numbered years for a certain amount of days, unless called into session by the governor, which is why we're here now. The executive branch is really the one that administers the policy we set throughout the course of the year. Given how much the executive branch can be involved and marshal the state's resources, why wouldn't we give the executive branch the flexibility it needs during this session until we come back in January? And I'm not saying that even we have to give some full type of authority, but let's talk about how we can set this up for when things are as bad as they are now. What if they get worse? We've talked about the idea of allowing local control. But if the counties get above a certain level, simply giving the executive branch back the powers it had in the old 39A so that the state's resources can be marshaled, whether that's extra ventilators, National Guard, whether it's certain emergency powers that would allow for, doctors and nurses to come in from out of state, or whether it's even having masks so our schools can stay open. The things that we can't adequately predict right now, I appreciate some of the things that are in this resolution. I'm glad we're here working on this problem, but my question is, why aren't we giving even more flexibility given the way that state government is structured and we're not able to come back if things get worse?
Brief response, Mr. Chairman.
Yes, you may.
Having been elected to the General Assembly and engaging in the process by which we make policy has been educational for, I think, all of us going through this process. Having 138 voices in the room to make policy is critical to getting closer to the people. And we often, as Senator Thayer did on the floor a few moments ago, spoke about us being the people's branch of government. President Stivers always uses that story of walking through the grocery store and people stopping him and saying, hey, how about this, or consider that, or do this. We are, by nature of our creation, closer to the people. That's the reality. In addition, we have the ability, as the Supreme Court confirmed, and we long felt, by giving the governor emergency powers, we had the ability to limit those emergency powers. Now, more broadly, your question is, why should we constrain the executive at all? And that was intoned in your question, and let me finish my response, please, respectfully. It was intoned that why should we limit him or her, him in this case, at all? And I think that's inherent in the struggle of the process, and I think the process, as challenging as COVID is, the integrity of the process is vitally important as well. And so it is not an indication, what I'm going to say next is not an indication that I desire this to happen. But should we not get it right, the Constitution does not prescribe any limit on the number of times we can be called back into special session to get it right. And conversations about what it costs for us to be here, discussions about whether we agree or disagree, it's more important that the process and the integrity of the process be maintained, sustained for the purposes of the people, in my opinion.
Okay. Any other questions? If no other questions are before us, I'll open the floor for a motion. Senator Thayer.
Thank you, Mr. Chairman. And again, as I said on the floor, some people are going to think this resolution goes too far. Some are going to say it doesn't go far enough. That's often the nature of our work here. I like to use that old quote, "Don't give up the good for the sake of the perfect." And I wish we could be perfect, but we're human, so we're not going to be. So, but this is the product of work that most of us already voted for back during the regular session, as President Pro Tem Givens illustrated, and collaborative efforts over the last 2 weeks. There's some things in here that the governor wants. There's some things not in here that the governor wants. There's some things in here that legislators want. There's some things in here that some legislators don't want. And that's going to be the theme over the next couple of days. That is the very nature of the legislative process. But the people are speaking through their 138 duly elected legislators. And so with that in mind, and by the way, just a reminder, civics reminder, resolutions are adopted, not passed. So I will make the motion that this resolution be reported favorably. Motion, same shall be adopted.
We have a motion by Senator Thayer, second by Senator Wheeler. Madam Clerk, please call the roll.
Senator Alvarado,
I can explain my vote, Mr. Chairman.
Yes, you may.
I'm going to cast an aye vote somewhat reluctantly over that one issue that I know is going to be coming back for us to discuss again. Again, I don't see how having the ability to write more narcotics and controlled substances helps us with COVID-19, but there are so many other important clauses in this bill that are really needed for right now for us to be able to continue to do this in the next few months. So I cast an aye vote.
was that a no?
That was an aye.
Aye. Senator Harper Angel,
Explain my vote, Mr. Chairman.
Yes, you may.
I vote aye in order to move the process forward. Thank you, Mr. Chair.
Senator McDaniel,
Aye.
Senator McGarvey,
Explain my aye vote, Mr. Chairman.
Yes, you may.
I will vote aye to move this along today. But I am one of the people who's concerned this doesn't go far enough because of what hangs in the balance. And Senator Givens, we cannot call ourselves back into special session. And on this, we also can't afford to get it wrong. When we see the staggering numbers, when we see the people who are struggling and the people who are dying, I want to make sure that when we leave here, that our state has the ability to protect her people in every circumstance. And I hope that we can get to a product that does that to everyone's satisfaction.
Senator Nemes,
Aye.
Senator Schroeder, Senator Southworth,
Explain my no vote, Mr. Chairman.
Yes, you may.
In one instance, you might have a situation where some parts of the bill aren't amazing and the others you can kind of glaze over and get through it. And I was just barely a yes vote on HJR 77, and that was in March. And this is now September. And we're looking at a whole different world ahead of us. In March, we thought we were getting out of something. Right now, we're getting into something. And so I cannot continue down the same path. I imagine we're going to have the exact same bill in front of us again in January, again in April, and who knows how many more years in the future. I think we need to actually take some more serious action, and treatments are one thing, and we'll talk about a lot more of those things in other committees. But I am voting no, and for the one piece of this that might be a little more saving grace than anything else, Nicholas County, I hope, they could ask for their own extension. We wouldn't necessarily have to do that. So I don't find that those things make it to where I can't go ahead and vote the right way. Thank you.
Senator Storm,
I'd like to cast my vote and explain.
Yes, you may.
I'm going to vote aye today because it is limited in scope and duration. It's set to expire, according to my reading of this, January 15th, 2022. And so, therefore, I'm going to vote aye.
Senator Thayer,
Aye.
Senator Wheeler,
Mr. Chairman, explain my vote.
Yes, you may.
I vote aye. I'd like to echo the comments of the senator from Scott. We can't get perfect legislation, but we have to try to give it as good as we can go. I think this legislation does that. It preserves an appropriate balance between the legislative and the executive. And to address this gentleman from Jefferson's comments, I think if Governor Beshear is concerned about these powers that we're delegating to him, that they're not enough, he can always call us back in. That is his prerogative under the Constitution. I think that this bill will correct the balance between the legislative and executive, and therefore I cast an aye vote.
Senator Mills.
I'd like to explain my vote too. I'll vote yes. And Senator Givens, I'd like to compliment everyone that's worked on this. This has been a true compromise. A lot of work has gone into this bill to help our Commonwealth. So Senate Joint Resolution 1 passes 10-1, and it will move on to the Senate floor. Thank you, sir. Next on our agenda is Senate Bill 4, and Senator Wilson is coming to the desk to present Senate Bill 4. Senator Wilson, the floor is yours.
Thank you, Mr. Chairman and members of the committee. I come before you today to present Senate Bill 4, which is actually legislation that we saw last session. I know that there has been a lot of concern expressed for the People's Branch when we come into special session of the cost of a special session. What this legislation does is that in the event that we are called from now on to a future special session, this will actually waive our pay for those days if there are veto days needed during that special session. Not necessarily are they always needed, but in the case that they are, we have up to 10 days that the governor has to either actually let it go into law without his signature, actually veto it, or sign it. And basically what this does is says during those 10 days when we're sitting around doing nothing, there's no reason that we should be paid. That is legislation that we had last year, didn't make it across the finish line, but it would take a lot of those issues off the table, especially since we have an amendment that's actually going to be on the ballot to be voted for, that the legislature, with agreement of the Speaker of the House and the Senate President, can call themselves into a special session, and currently the governor is the only one who can. So in the event that that is passed by the people as an amendment to the Constitution, then we have the ability to call ourselves into session by reserving days that are currently in our session, and when we do that, those days are left over for us to be able to call ourselves back into session. We would not be paid for any veto days. That's what the bill does, and it's very simply, and with that, Mr. Chairman, we'll answer any questions.
Any questions for Senator Wilson? Senator Wheeler, do you have a question?
Let's make a motion on the bill, Mr. Chairman.
Okay, let's see if we have any questions or concerns. If not, we have a motion for approval from Senator Wheeler. Second. We have a second from Senator Thayer. Madam Clerk, please call the roll.
Senator Alvarado.
Aye.
Senator Harper Angel. Didn't hear her. Aye.
Yep.
Senator McDaniel.
Aye.
Senator McGarvey. Aye. Senator Nemes.
I'd like to explain my pass vote.
Yes, you may.
I don't think this was in the call, so I'm not sure that we should or could do this. I did vote for this in the regular session where I think this needs to be, and the people will always want to cut our pay, which I'm not adverse to. Like I said, I voted for that before. Thank you.
Senator Schroeder. Aye. Senator Southworth.
Explain my no vote.
Yes, you may.
I was prepared to vote yes on this morning, but after hearing some of these concerns relating to the Constitution and the call, as well as having thought about it a little bit more thoroughly, if we should have prioritized this in discussing our Senate Bill 1 and other bills earlier this session, if it was important, we should have just prioritized and got it over the finish line during the regular session. And if we're supposed to be passing bills here literally overnight, we were calling into session today and we're ready to pass stuff, seems like the governor should be able to veto his stuff overnight if he is ready to go. We have a hard job. He does too. It's just, I'll do it. So I'll just go ahead and vote no on this right now.
Senator Storm.
I'm going to vote aye today.
Senator Thayer.
Explain my vote.
Yes, you may.
Thanks, Mr. Chairman. I'm going to vote aye. It always sort of amazes me when when it gets time to talk about extraordinary sessions, people get all exercised about the cost of $72,000 a day. I mean, that's a bargain to reestablish the balance of powers and protect our liberties and freedoms over the next couple of days. But the governor makes a big deal about that cost, but then nobody blinks an eye giving $1 million away in a lottery vaccine or a vaccine lottery. So I just want to point out sometimes the political arguments made up here really are nonsensical. But and I believe, having been here longer than most of the folks on this committee, that the people of Kentucky get a good value for their dollar for what General Assembly members are paid. And here's a proposal where we're saying during a special session, we're willing to cut our pay during the 10 days that the governor by Constitution can take to sign, veto, or otherwise let the bill become law without his signature. And I think it's a pretty good proposal that will not affect this special session. You cannot change the pay of the General Assembly during a session that is currently underway. It has to be prospective moving forward. So I vote aye. I think it's a good bill, and I hope we pass it.
Senator Wheeler,
Aye.
Senator Mills,
I vote aye, and Senate Bill 4 passes 9 yeses, 1 no, and 1 pass. So same shall pass onto the Senate floor. And with that ends our agenda. Is there a motion for adjournment? All in favor, say aye.
Aye.
We are adjourned.